Okay, so now let's talk a little bit about growth hormone and its effects on metabolism, where it comes from, how it's secreted, things like that. All right. So just as we've done for the other hormones, let's address this one. So just by way of basic introduction, growth hormone is actually secreted from the anterior pituitary. I'll show you that in a moment. So unlike something like cortisol, which is secreted from a target organ, this is actually secreted directly from the pituitary. It is a protein, and it is released in response to growth hormone releasing hormone, and it will not surprise you to learn that this will come from the hypothalamus. And it is secreted in response to decreases in glucose and fatty acids. Okay, so its primary job is going to bring these back up toward normal. Okay, in terms of metabolism. It is inhibited by somatostatin. I will show you that. That also comes from the hypothalamus. And high glucose and fatty acids will bring growth hormone levels back down because you don't need to increase your circulating levels of substrate in that case. It binds to membrane receptors, as you might expect. It's a protein. It can't get across the membrane. And its primary job is to bring blood glucose back up toward normal. It also stimulates growth through the release of insulin-like growth factor, IGF. And I'll show you that, but we won't address that in detail here. We'll talk about that in your second year. Okay. So just to remind you, glucose are regulated variable. Insulin brings high glucose levels back up down toward normal. Your other hormones affecting metabolism bring low glucose levels back up toward normal. Okay? Here's our familiar table now. We have insulin here. Its job is to bring glucose down. Okay? And we have our other four hormones here, and their job is to bring glucose back up in response to low glucose. All right? And the one that we are going to talk about in particular now is growth hormone. And again, growth hormone generally, its job is going to be to bring substrate levels back up toward normal. Lipid and glucose in this case primarily. All right? So in that respect, increasing glycogenolysis, just like it made sense here and here, that should make sense. You want to break down glycogen, produce glucose to increase plasma glucose. Increasing gluconeogenesis also should make sense to you. You want to increase plasma glucose, get it back up toward normal. Blocking glucose uptake, just like these others, whether that makes sense to you or not, too bad. It does in terms of maintaining substrate levels, and that's the primary job of your endocrine system here. And so your blood glucose levels will come back up toward normal if you do that, just as you see here. Job of growth hormone, increasing blood glucose in the face of a decrease in blood glucose. Lipolysis is increased and blood fatty acids are increased. And one of the stimuli for release of growth hormone is low blood fatty acids. So increasing lipolysis to get those back up toward normal should make some sense to you. And remember, the response in terms of proteolysis across these hormones is variable. Cortisol increased proteolysis. Epinephrine had no effect. Growth hormone is actually going to decrease proteolysis. And the reason for this is because of growth hormone's other effects, that is upon growth. If you're going to stimulate growth, which growth hormone will do, then you're not going to want to break proteins down, you're going to want to make proteins. And so one of the effects of growth hormone is to stop the breakdown of proteins for energy in order to build tissues up, okay, and allow growth to take place. So that, generally speaking, that explains the effects on proteolysis and why proteolysis and blood amino acids are actually decreased in response to growth hormone, okay? But these effects, in terms of metabolism, should make sense to you. You're bringing blood fatty acids up, you're bringing blood glucose up, back toward normal, allowing adequate supply of substrate to tissues, okay? All right. So here is our now, I hope, familiar hypothalamic pituitary axis. In this case, you have a variety of different target organs. The liver is a big one, especially in terms of growth. So here's our hypothalamus, okay? And here is our, again, this is part of the brain. It's connected through this stalk to the pituitary. So here we have capillary bed 1, here we have capillary bed 2. We have our portal vessels connecting the two, okay? And then your pituitary will release hormones to the tissues where growth hormone will initiate a variety of different responses, okay? The hypothalamus secretes GHRH, that's growth hormone releasing hormone, okay? And it also secretes somatostatin, okay? Somatostatin and growth hormone releasing hormone will act upon the pituitary. In the case of somatostatin, you get an inhibition of the release of growth hormone from the anterior pituitary. In the case of growth hormone releasing hormone, you get an increase in growth hormone. So when growth hormone secretion goes up, somatostatin will have gone down, and growth hormone releasing hormone will have gone up. The hypothalamus will decrease this and increase this. The combination will increase growth hormone secretion from the pituitary. If you want to decrease growth hormone, then you will increase somatostatin from the hypothalamus and decrease growth hormone releasing hormone from the hypothalamus, and that will decrease GH release from the pituitary. GH acts upon the liver and other tissues, okay? And one of the things that it does, particularly in the liver and in the growth plates in your bones, is it causes the release of this insulin-like growth factor. This, IGF, mediates most of the growth response that you get in response to an increase in growth hormone. We'll talk about that more in your second year. Just be aware that's why it's here on this graph, and that's why it's involved in the feedback loops that I'm going to talk about in a minute, all right? The effect of, but growth hormone also has direct effects upon particularly the liver and the adipose tissue and other tissues, and these are the effects that affect metabolism, okay? So IGF mediates most of the growth function, but the effects on metabolism are mediated mostly directly from growth hormone, okay? And the liver and the adipose tissue are very involved in that, okay? As you might expect, with a hormone whose job is going to be to increase blood glucose and free fatty acids, okay? And notice that high glucose, high fatty acids inhibits the release of GHRH from the hypothalamus and stimulates the release of somatostatin, which will decrease the release of growth hormone. So an increase in these levels decreases growth hormone, and a decrease in glucose and free fatty acids will cause an increase in growth hormone. They will cause a decrease here and here will cause an increase in GHRH and a decrease in somatostatin that will combine to increase growth hormone, okay? So note that those two things in particular, because they're sort of what we're talking about here in terms of regulation of metabolism and plasma levels of substrate. These regulate the release of growth hormone through their effects on the hypothalamus, okay? You will also note these feedback loops, very similar to what we saw in cortisol. Both growth hormone and IGF feedback upon the hypothalamus. And so if growth hormone and or IGF get too high, you will inhibit the release of GHRH and increase the release of somatostatin from the hypothalamus to bring growth hormone and IGF back down toward normal. And IGF also feeds back upon the pituitary to decrease growth hormone release, so it will also regulate release directly from the pituitary. And again, this is just a way of keeping this system from getting out of control. If these levels get too high, you want to bring them back down toward normal to keep them within a reasonable range. I mean, if you want more growth hormone, you want to get more growth hormone, but you don't want to let it go wild, okay? You don't want it to get so high that you might get adverse effects over time, okay? So these levels are regulated by negative feedback. They keep a cap on the levels of these hormones, just like they keep a cap on the level of cortisol, okay? And as you will find out, on the level of thyroid hormone as well, okay? All right, so stimuli for the release of growth hormone, hypoglycemia, low free fatty acid levels, just as I pointed out. You do get an increase in growth hormone with stress. It is not a big issue, but it's there. On the other hand, hyperglycemia, high free fatty acids, and obesity, which is an indication that you've got high levels of free fatty acids and high glucose, these all will inhibit the release of growth hormone, okay? Just a side note, of course you know the overall effects of catecholamines will be to increase plasma glucose levels, but you can pharmacologically alter the effects of growth hormone, the release of growth hormone. Alpha adrenergic agonists will stimulate the release, beta adrenergic antagonists will stimulate the release of growth hormone, and alpha adrenergic antagonists and beta adrenergic agonists will decrease the release. Not something that I'm particularly worried about at the moment, but you may hear it from the pharmacologist, so there it is for you. Finally, again, a reiteration of some of the effects of growth hormone here. We have an increase in lipolysis, which will bring free fatty acids back up in the bloodstream toward normal. We have an antagonism of the effects of insulin on glucose metabolism, which will ultimately bring glucose levels in the plasma back up toward normal. And ultimately, you will bring fatty acids and keto acids up in the plasma as well, okay? So these should make sense to you based upon what I've already told you. The increase in amino acid transport, the increase in protein synthesis, these have to do with growth hormones' effects on growth and the fact that these are things that you're going to want to stimulate in order to stimulate growth. So those should sort of make sense to you as well, all right? All right. And finally, we have the effects on growth. Not particularly worried that you know these more in your second year on this, but for the record, growth hormone stimulates growth as you might expect, okay? All right, thank you for your attention.